Hello, and welcome to the adaptation presentation for bipolar disorder in the classroom by Tammy, Mohatt, and Matthew Moon. What is bipolar disorder? Bipolar disorder is a serious mental disorder which is characterized by alternating periods of extreme highs and extreme lows. Periods of excessively high energy are called mania and include both euphoria and irritability. Periods of excessively low energy are called depression. There is no cure for bipolar disorder. There is treatment available with medications and therapy that can help to ease the symptoms, however. The symptoms of bipolar disorder in children. During periods of extreme high, called mania, children typically exhibit irritability rather than euphoria. Euphoria is typically seen in adults. In a classroom, manic students may have rages or tantrums, and they may display oppositional behavior. They may also appear hyperactive, distractible, and impulsive. This leads to increased comorbidity with attention deficit disorder. And students will have frequent mood swings and could potentially act silly or goofy or giddy if they do happen to experience euphoria during their mania. Some other possible symptoms are listed here. And bipolar disorder in children and adolescents. Research indicates that most people diagnosed with bipolar disorder are diagnosed as teenagers between the ages of 13 and 18. There are various degrees of bipolar symptoms, and teens that exhibit symptoms are likely to have more severe varieties of bipolar disorder as adults. Adaptations for academic success. Teaching students with bipolar disorder adaptive strategies strengthens the students' academic abilities long after they leave your classroom. Students with well-developed adaptive strategies can use them in high school, college, and in their future careers. Some ways we can help our students that are suffering from bipolar disorder are we can talk with school mental health providers, which are the counselor, psychologist, and communicate the students' needs clearly. We can provide highly structured classroom settings. Predictability will offset any impairments the students may be experiencing, both emotional and cognitive. And it also allows students to have a lower affective filter and feel safe in the classroom. We can also teach our students problem-solving skills and stress management techniques to help them deal with frustration and negative thoughts that they may have. We can then also make reasonable accommodations like those you would for any student that has short attention span, hyperactivity, or organizational difficulties. And also as teachers, we can be flexible, be ready to make small changes to lessons as the need arises, allow our students to progress with material in different ways, so long as learning objectives are met. Tolerance and patience for the student. We need to be understanding of their struggle, and so they are able to feel safe and able to trust you, because safety, trust is necessary for the student to be able to learn. We can shorten assignments when needed to reduce the stress levels the students are experiencing. Students are under a heavy workload, and so being able to shorten an assignment for a student could potentially give them peace of mind and help them to get through a crisis. And finally, we can create and maintain a support network between the school, parents, and mental health providers to ensure there is a good communication about the student's needs. We can discuss what is working or what is not working regularly with the support network and make sure we are changing what is being done for the student as needed. Here we have some resources for bipolar disorder in the classroom, if you'd like to educate yourself further. And that is the conclusion of bipolar disorder in the classroom. Thank you. Have a nice day.